They told you these pills would keep your heart beating, but what if they were quietly poisoning it instead? Across the country, millions of Americans swallow their daily heart medications without a second thought, trusting the labels, the doctors, the FDA seals. Yet behind that trust, a terrifying reality is emerging. At least 6 widely used heart drugs, from blood pressure staples to life-saving beta blockers, have been found tainted with dangerous impurities, industrial chemicals, and even metal fragments. Some have been tied to cancer risks, others to sudden cardiac arrest, and some to deaths that were written off as natural causes. How many of those bottles in our medicine cabinets are ticking time bombs disguised as treatment? How many lives have already been cut short by the very drugs meant to prolong them? And perhaps most chilling of all, why did it take federal regulators stepping in for us to hear the truth? This is the Downturn Report, where the truth gets personal. And before you panic, stay with us, because by the end of this video, you'll know not only which medications to avoid, but also the safer alternatives that could truly protect your heart. Number 1. Valsartan. What if the pill you take to save your heart is quietly plotting against it? That's the gut punch millions of Americans felt when valsartan, once hailed as a cornerstone treatment for high blood pressure and heart failure, was exposed as a wolf in a white-coated disguise. The shock started when regulators found this widely prescribed drug tainted with NDMA and NDEA, industrial chemicals so toxic they're more at home in rocket fuel than in your bloodstream. FDA testing revealed contamination as high as 17 micrograms per tablet, a dose experts compared to inhaling hundreds of cigarettes. Except this wasn't a reckless choice, it was a doctor's prescription. Shipments crossed borders for years, filling the bodies of retirees and factory workers who trusted the system, until a global recall across more than 80 countries finally pulled back the curtain on what might be the most grotesque betrayal in modern medicine. But the rot runs deeper than one dirty batch. Investigations trace the source to Zhejiang Pharmaceutical in China, where shortcuts like solvent recycling and sloppy cleaning were chosen over safety. Think of it as your brake shop deciding duct tape is good enough. Except the crash here could be cancer, not a crumpled fender. Regulators had warning signs long before the scandal erupted, but oversight was so lax it bordered on willful blindness. Internal FDA documents later revealed falsified test data, doctored chromatograms, and missing impurity records. Clear evidence this wasn't a mistake, but a calculated gamble with human lives. It's as if Big Pharma looked at the roulette wheel and decided to spin it with your organs on the line. The human toll is staggering. By mid-2025, over 1,300 lawsuits had been filed in the United States, many from patients diagnosed with liver, stomach, or colorectal cancers after years on valsartan. Some suits go further, accusing companies not just of negligence but of racketeering, knowingly selling poisoned medicine while hiding the truth from regulators and the public. And yet, in a country where a factory worker can lose his job for missing a shift, not a single executive has faced criminal charges. They've offered polished apologies, slapped new and improved labels on supposedly clean products, and moved on, while patients count down the days they have left. And that's the most chilling part. This isn't just about one drug. It's about a system that decided saving a few dollars was worth gambling with American lives. In the relentless race to cut costs, production of valsartan moved overseas, where over 80% of active drug ingredients now come from plants that are rarely inspected, and often with advance notice, giving companies time to scrub away evidence. It's like hiring the cheapest parachute maker and acting shocked when it doesn't open. The risk isn't theoretical. It's swallowing poison disguised as medicine every single day. For millions of older Americans, retirees on fixed incomes, and working-class families scraping by, this wasn't a recall. It was a betrayal delivered in a pill bottle. Imagine waking up each morning believing you're prolonging your life, only to learn that each dose might be shaving years off it. That's not healthcare. That's Russian roulette in prescription form. And if that doesn't shake you to your core, you might already be one of valsartan's silent casualties. Yet all hope isn't lost. If this revelation has you eyeing your medicine cabinet like a crime scene, there are safer choices that haven't been caught slipping poison into your veins. Losartan, Cosar by Merck, Olmesartan, Benicar by Daiichi Sankyo, and Condesartan, Atacand by AstraZeneca remain trusted alternatives. Because when it comes to protecting your heart, the last thing you should have to swallow is betrayal. Number 2. Carvedilol. If valsartan was the betrayal that screamed in headlines, carvedilol is the one that whispers from the shadows. the smiling beta blocker that slips a knife between your ribs while pretending to guard your heart. Once prescribed by the millions as a cornerstone treatment for heart failure and hypertension, this drug, especially the generic versions churned out by Glenmark Pharmaceuticals and distributed by Remedy Repack, has become a symbol of how deep the cracks in America's drug safety system really go. In 2025, Glenmark announced a nationwide voluntary recall of multiple lots after lab tests uncovered N-nitroso-carvedilol, NNCII, a nitrosamine impurity known to increase cancer risk, at levels above FDA's acceptable intake limits. The recall, covering strengths from 3.125 milligrams to 25 milligrams, spanned multiple packaging formats and affected over 732,000 bottles. Officials tried to downplay the danger by labeling it a Class 2 recall, supposedly posing only a low risk. But for older Americans with fragile hearts, low risk sounds an awful lot like spin the chamber and pull the trigger. And this wasn't a freak accident. Glenmark's carvedilol saga reads less like a single incident and more like a rap sheet. Repeated recalls over nitrosamine contamination, cross-contamination, and outright manufacturing failures have become the norm, not the exception. FDA inspections have painted a picture that would make even a high school science fair blush. Dusty equipment, filthy workspaces, sloppy cleaning, and data manipulation so brazen it looked like a toddler forged the report cards. One inspection found falsified testing results and accused Glenmark of knowingly releasing substandard carvedilol batches into the market. Another flagged chemical cross-contamination risks from other production lines, meaning mystery compounds could be hiding in pills meant to regulate someone's heartbeat. It's the pharmaceutical equivalent of ordering a salad and finding shards of broken glass mixed in. Except this salad is supposed to keep you alive. The rot doesn't end in the lab. Legal filings and whistleblower complaints allege that Glenmark and its partners pushed carvedilol far beyond its medically justified uses, promoting it for mild hypertension or even as a preventive therapy. An aggressive marketing strategy that critics say was about swelling profits, not saving lives. Every unnecessary prescription written was another older American unknowingly stepping into the line of fire for side effects like dangerous bradycardia, plunging blood pressure, or sudden cardiac collapse. It's hard not to see the irony, a drug designed to steady the heart being handed out like candy in ways that could stop it altogether. But perhaps the most sinister part of the carvedilol disaster is its stealth. Unlike valsartan's contamination, which triggered public outrage with talk of carcinogens, carvedilol's danger often hides in silence. A slightly underdosed tablet may leave your heart too weak to fight, while a slightly overdosed one can slam the brakes on your cardiovascular system entirely. It's a threat so quiet, it's almost polite. The pharmaceutical version of carbon monoxide, slipping into your bloodstream without warning. And when the FDA itself admits that nearly 1 in 5 overseas drug plants it inspects has major violations, it's clear that this isn't a fluke. It's the system working exactly as designed. Profit first, oversight later. For millions of retirees and low-income Americans relying on generic medications to survive, this isn't just about one pill, it's about a shattered illusion. They believed their prescriptions were shields, not potential weapons. They believed the FDA was a watchdog, not a sleepy mutt waking only after the burglar's gone. And they believed the affordable generics at the pharmacy counter were a blessing, not a ticking time bomb. Carvedilol's scandal is a brutal reminder that the threats to your heart don't always come from cholesterol or stress. Sometimes they come sealed in a bottle from halfway across the world. If that realization makes you want to audit your medicine cabinet, there are safer and better monitored beta blockers that haven't been dragged through the same swamp of contamination, falsified data, and reckless marketing. Metoprolol succinate, Toprol XL by AstraZeneca, Nebivolol by Stolic by Forest Laboratories, and Bisoprolol fumarate, Zebeta by Duramed, remain trusted alternatives that offer the same life-saving benefits without the toxic baggage. Because when the beating of your heart is on the line, probably safe is nowhere near good enough. Number 3, digoxin. If there were ever a drug that shows how the miracle of modern medicine can morph into a loaded weapon, it's digoxin, the century-old heart medication that saved countless lives while quietly claiming far too many. Known under names like Digitec, Digox, and Lanoxin, this cardiac glycoside is supposed to steady irregular heartbeats and strengthen failing hearts. Yet its history is soaked in scandal because digoxin walks a razor-thin line between remedy and poison, and manufacturers have stumbled across that line again and again. One of the most notorious disasters struck when Digitech tablets were discovered to be double their intended thickness, delivering twice the labeled dose. In a drug where even tiny deviations can mean the difference between life and death, that was not a minor mistake. It was a fully loaded round in a chamber pointed at patients' chests. The consequences were devastating. Waves of digoxin toxicity, cardiac arrests, sudden deaths, and a flood of lawsuits accusing activist Ottawa of negligence, defective manufacturing, and even wrongful death. But that was only the tip of a much darker iceberg. Digoxin's margin of safety is so narrow it might as well be written in pencil, and yet manufacturers have repeatedly failed to control dosing with precision. Whistleblowers and FDA inspection reports revealed horrifying lapses: contaminated production lines, sloppy testing, falsified records, and a corporate culture more interested in quarterly profits than patient safety. Even after discovering irregular doses, insiders alleged activists continued shipping tablets, gambling that regulators would stay asleep. They did until hospitals started reporting clusters of unexplained cardiac emergencies linked to Digitech. The FDA's eventual intervention wasn't triggered by corporate responsibility. It was triggered by a trail of patients collapsing in ERs, and the disasters didn't stop there. In 2023, Marlex Pharmaceuticals recalled 2 lots of generic digoxin tablets after a labeling mix-up meant bottles marked 0.125 milligrams actually contained double the dose, and vice versa, a simple error with potentially deadly consequences. In Canada, a year later, Jamp Pharma was forced to recall digoxin tablets because oversized pills delivered dangerously high doses. With a drug like digoxin, where dosage precision is everything, even a few milligrams too much can mean bradycardia, blindness, confusion, pacemaker implantation, or death. It's like trying to defuse a bomb with greasy hands. One slip and everything blows. The chaos hasn't been limited to the factory floor. Digoxin has also been weaponized by human hands in ways that defy belief. Infamous nurse Charles Cullen admitted to murdering dozens of patients by overdosing them with digoxin, triggering a wave of suspicious code blues over decades. And in one malpractice case, an 86-year-old woman died after receiving 10 times the intended dose due to a data entry error during a hospital transfer. Her family settled for $1 million. The drug's lethal potential is so well known that its misuse has become the stuff of criminal investigations and courtroom drama. Even when used as intended, digoxin's record isn't reassuring. Major studies have linked it to a 21% higher risk of death in atrial fibrillation patients compared to those not taking it. Yet doctors continue prescribing it to millions, often without close monitoring, waving it off as old but reliable. Critics argue it's more like old but tolerated, a relic from a time when medicine accepted dangerous side effects because there were no safer alternatives. Add to that price-fixing scandals, including allegations that companies colluded to raise digoxin's price more than 7-fold in just 2 years, and the picture turns uglier still. For retirees on fixed incomes, that's not medicine, that's ransom with a prescription label. The coldest part of all may be how the industry calculated its risks. Internal memos revealed that companies knew about dosing variability for years but continued production anyway, banking on the fact that most victims were elderly with pre-existing conditions. Deaths too easy to write off as natural causes. That's not just negligence, it's cynicism so profound it makes tobacco executives look like humanitarians. And even after hundreds of lawsuits, many cases ended in quiet settlements with no admission of wrongdoing, leaving the same pills on pharmacy shelves and the same vulnerable patients swallowing them. For older Americans who were told digoxin is your heart's best friend, the truth is far more sinister. That friend might just be holding the knife. Each pill is a coin flip between healing and harm, and too many times, that coin has landed on the wrong side. If you're done gambling with your heartbeat, safer alternatives exist. Ivabradine, Corlinor by Amgen, Dofetilide, Ticacin by Pfizer, and amiodarone, Passerone by Upsher-Smith offer rhythm control without the razor's edge risk or the decades of scandal, because the drug meant to save your life should never be the one that takes it. Number 4. Atorvastatin. If you ever needed proof that corporate greed can grind even life-saving medicine into shards of betrayal, look no further than atorvastatin, the cholesterol-lowering blockbuster better known as Lipitor and its many generics. Once hailed as the guardian angel of heart health and prescribed to more than 35 million Americans, atorvastatin was supposed to keep arteries clear and heart attacks at bay. But the facade shattered, quite literally, when Ranbaxy Laboratories, one of the world's biggest generic suppliers, was forced into a recall after discovering microscopic glass particles embedded in its atorvastatin tablets. These weren't harmless flecks. They were sharp fragments of contamination from production equipment, potentially capable of slicing their way through the human digestive tract. The FDA tried to reassure patients that the risk was extremely low, but let's be honest, no one signs up to swallow glass with their cholesterol medication. 41 lots were pulled from shelves, production was halted, and the illusion of safety collapsed with them. But the glass scandal was just the symptom of a much deeper disease. Ranbaxy wasn't simply careless. It was criminal. The company admitted in court to fabricating data, falsifying safety reports, and submitting hundreds of fraudulent applications to the FDA, all while distributing adulterated drugs across the U.S. supply chain. In one of the most damning settlements in pharmaceutical history, Ranbaxy pleaded guilty to felony charges and coughed up $500 million in fines. Investigators found that batches which failed safety tests were deliberately hidden from regulators and still shipped to American pharmacies. Even worse, internal emails revealed deliberate delays in alerting the public about the glass contamination. Pharmacies were warned privately, but patients kept swallowing the tainted pills for nearly 2 weeks before any public notice appeared, and even then it was buried quietly on the company's website. That's not a safety recall. That's a cover-up with a corporate logo slapped on top, and the rot wasn't confined to one factory or one recall. FDA inspections at Ranbaxy's Indian facilities revealed bacterial contamination, filthy water systems, unsterilized equipment, and falsified manufacturing records. Entire batches of atorvastatin were produced without stability testing or with incomplete dissolution data, meaning pills could dissolve too quickly, too slowly, or not at all. It's the pharmaceutical equivalent of installing seatbelts made of tissue paper and hoping no one crashes. Yet despite these glaring red flags, the FDA allowed Ranbaxy to keep shipping drugs into the US, citing vague remediation efforts. Translation: the fox promised it wouldn't eat any more chickens. The betrayal extended far beyond contamination. Patients who believed they were taking a simple cholesterol pill soon reported devastating side effects: rhabdomyolysis, acute kidney failure, liver damage, and irreversible nerve injuries. Studies showed women taking atorvastatin faced a 48% higher risk of developing type 2 diabetes. Lawsuits piled up, accusing Pfizer, Lipitor's original manufacturer, of knowing about these risks for years and burying the evidence to protect billions in revenue. Predictably, the company denied wrongdoing, quietly settled many claims, and kept marketing Lipitor as a safe, everyday solution. It's like learning the manufacturer of your car's airbag knew it exploded in your face, but decided the lawsuit payouts were cheaper than a recall. And perhaps the most chilling part? All of this unfolded not in some shady back alley operation, but inside FDA-approved facilities, under the nose of regulators tasked with protecting the public. Congressional investigations uncovered fabricated documents, forged test results, and repeated failures to file required field alerts when batches failed quality checks. Patients were never told they were swallowing drugs produced under criminal conditions. They believed they were protecting their hearts. Instead, they were playing Russian roulette with every dose. For America's working class, retirees stretching Social Security checks, truck drivers trying to stay healthy for one more shift, veterans relying on generics to make ends meet, atorvastatin's story is more than a scandal. It's a betrayal of trust at the deepest level. These patients weren't warned that their so-called life-saving pills might come laced with glass or stamped with forged data. They weren't told that the company behind them had pleaded guilty to felony crimes, or that the regulators charged with protecting them had looked the other way. They trusted the system to guard their health. Instead, it gambled with their lives. If that makes you question what's really in your medicine bottle, safer statin alternatives exist, the ones that haven't been dragged through the same swamp of contamination, fraud, and concealment. Rosuvastatin, Crestor by AstraZeneca, Pravastatin, Pravatrol by Bristol Myers Squibb, and pitavastatin, Livalo by Kowa Pharmaceuticals, remain widely trusted and better monitored. Because when the goal is protecting your heart, you shouldn't have to wonder if your medicine was made with glass shards and lies. Number 5. Spironolactone. If atorvastatin's betrayal was like swallowing shards of glass, spironolactone's story is the slow, metallic poison that slips past your guard, quiet, invisible, and just as deadly. Long marketed as a gentle diuretic that protects the heart, spironolactone has been prescribed to millions of Americans battling congestive heart failure, resistant hypertension, and fluid retention. But behind that friendly label lies a trail of recalls, contamination scandals, and labeling disasters that make you wonder whether the pill in your organizer is medicine or a loaded weapon. The most recent alarm came in August 2025, when over 11,000 bottles of spironolactone 25 mg tablets, produced by Frontida Biopharm and distributed by Sun Pharmaceutical, were yanked off shelves after a consumer discovered a dark fragment embedded in a tablet. The intruder turned out to be aluminum contamination, likely from manufacturing equipment, sparking a Class 1 recall later downgraded to Class 2. Regulators assured the public the risk was low, but when it comes to metal in your medicine, low risk is just corporate speak for cross your fingers. And this wasn't an isolated slip. In 2021, Bryant Ranch Prepack recalled bottles of spironolactone after discovering a labeling catastrophe. Some bottles marked 50 mg actually contained 25, and vice versa. That might sound minor until you realize the consequences. Patients expecting a higher dose might get too little, losing critical therapeutic effect, while those unknowingly swallowing double the dose face skyrocketing potassium levels, potentially triggering hyperkalemia, lethal arrhythmias, or sudden cardiac arrest. In the world of spironolactone, even a tiny dosing mistake can flip the switch from treatment to time bomb. And these aren't freak accidents, they're symptoms of systemic rot. Industry analysts note that Sun and other generic manufacturers have issued multiple recalls across drug categories in recent years for foreign matter, poor dissolution, and particle contamination, painting a grim picture of quality systems stretched thin and oversight riddled with holes. Dig deeper, and the picture turns uglier still. Inspections of spironolactone manufacturing sites have uncovered filthy conditions, insect infestations, and corroded mixing tanks leaching heavy metals into the product, contamination that was never disclosed to patients or doctors. Whistleblowers described workers recycling leftover powder from previous batches to cut costs, a reckless shortcut that can distort potency and introduce foreign material. And internal FDA memos admitted that some overseas plants producing spironolactone hadn't been inspected in over 5 years, leaving vast swaths of America's drug supply effectively unmonitored. It's the pharmaceutical version of leaving your house unlocked and hoping burglars have better things to do. The recklessness didn't stop on the factory floor. Internal company emails exposed that spironolactone was aggressively marketed to high-risk populations, particularly older adults with kidney impairment, despite decades of evidence showing that even therapeutic doses can push potassium to fatal levels. A surge in spironolactone prescriptions coincided with a threefold increase in hyperkalemia-related deaths, according to an analysis in the New England Journal of Medicine. Yet marketing materials painted it as a mild water pill with minimal risk. That's not medicine. That's selling knives to toddlers and acting surprised when someone gets cut. The courtroom has also become a battleground. Class action lawsuits accuse manufacturers of failing to warn patients about hyperkalemia dangers, mislabeling dosage strengths, and hiding adverse event data from regulators. Some families suing over sudden deaths uncovered internal documents showing companies had flagged shipments for potential overstrength, but shipped them anyway to meet quarterly revenue targets. That's not a mistake. That's a business plan written in human blood. Meanwhile, critics accuse regulators of playing along, issuing little more than warning letters while allowing shipments from violators to continue flowing into U.S. pharmacies. The cops show up, wag their fingers, and walk away while the crime scene stays open. For millions of older Americans living on fixed incomes, spironolactone's betrayal is personal. They take it believing it will help them live longer, not realizing they may be swallowing mislabeled tablets, toxic metal fragments, or pills that could quietly drive their potassium past the point of no return. They aren't told that the safe and effective pill in their hand may come from a factory inspectors haven't seen in years, or that marketing campaigns downplayed risks known for decades. They trust a system that promised safety, only to discover it gambled with their lives. If that thought leaves you staring at your pill bottle with suspicion, there are safer alternatives that don't come with spironolactone's long shadow of contamination, mislabeling, and neglect. Eplerenone, Inspira by Pfizer, Torsemide, Demodex by Roche, and bumetanide, Bumex by Leo Pharma, provide similar cardiovascular benefits without the ethical baggage and regulatory failures. Because when your heart depends on a pill, probably safe isn't safe enough. Number 6. Impella. If spironolactone was a betrayal that crept in slowly, Impella is one that strikes in real time, sometimes right on the operating table. Marketed as a groundbreaking heart pump to support blood flow during cardiac crises, the Impella device by Abiomed, now Johnson & Johnson MedTech, has become one of the most controversial medical devices in America. It's been linked to at least 129 severe injuries and 49 deaths from heart wall perforations. Pump, failures, and sudden stoppages. Class I recalls, the FDA's most serious, revealed that Impella's catheter could tear through the heart wall, purge fluid leaks, could halt the pump mid-surgery, and underrated capacitors could trigger fatal shutdowns. Some controllers even failed to detect their pumps, cutting off circulation without warning. Worse, whistleblowers say Abiomed knew about many of these risks, but continued selling devices and delayed reporting hundreds of adverse events. Regulators accused the company of manipulating data and hiding safety issues, while investigations uncovered aggressive and possibly illegal marketing campaigns pushing Impella into low-risk cases for profit. A Department of Justice probe even cited potential kickbacks to doctors to boost implant numbers. The betrayal hits hardest for elderly Americans on fixed incomes, many of whom consented to Impella procedures believing the device would extend their lives, only for some never to leave the hospital alive. Families have filed lawsuits alleging that loved ones died from pump malfunctions or heart perforations. If that leaves you uneasy, alternatives like intra-aortic balloon pumps, IABPs, Tandem Heart by LevaNova, and HeartMate LVAD by Abbott offer support without Impella's trail of recalls and lawsuits. Because a device meant to save your heart should never make you wonder if it will tear it apart instead. Your heart deserves truth, not betrayal. Subscribe now and join us as we expose what they don't want you to know.
Thank you for watching today's video all the way through. If you found the content helpful, don't forget to click like and subscribe to stay updated to our latest daily videos. Now feel free to check out other featured videos currently shown on your screen. Goodbye, and see you in the next video.